This is Eye on the Community, and I'm your host, Sean Anthony. And joining us next is the CEO of PrimaryOne Health, Ms. Charleta Tavares. Welcome back to the program. How are you?
I'm doing great. How about yourself?
I'm doing good. Good to have you back on again. And as we enter into 2022, we know that last year was challenging for healthcare organizations and for many Americans, and of course, Central Ohioans. Tell us about PrimaryOne Health, in 2021.
Well, 2021 was a very challenging year, as you shared, not only with the virus, but also the subsequent variant, the Delta variant. And so that brought a lot of challenges to PrimaryOne Health as well as our sister organizations. And as you know, disproportionately, our racial and ethnic populations bared a disproportionate burden of COVID hospitalizations, and all the impacts of the disease. Our vaccine events throughout 2021 were very good, very strong with partners in the community. We had one mobile health center at the end of 2021, and then soon thereafter, we got another mobile health center. So it was able to help us partner with community-based and faith-based organizations to not only give our community residents and patients the tests, the COVID tests, but also the vaccines.
Speaking of the vaccines, Ms. Tavares, how did your vaccine and testing services go last year?
Well, last year we did very, very well. We probably tested over 6,000 and vaccinated over 14,000 individuals throughout the community. We're proud of that because as the oldest and largest FQHC in Central Ohio, it's incumbent upon us to do our part to help Columbus Public Health, to help Franklin County Public Health, and all the hospital systems get as many of our residents vaccinated and tested as possible.
From my understanding, you guys are celebrating 25 years. PrimaryOne Health has been serving the community for a quarter of a century. Tell our audience about PrimaryOne Health.
Well, thank you, Sean. We are very proud of our 25-year history as a system of healthcare, an FQHC that's been around for 25 years. But what many people don't understand is that the first community health center was started more than 40 years ago in Columbus with the Billy Jones Brown Health Center in the Mount Vernon Plaza. That was the first community health center, which became a part of PrimaryOne Health, then known in 1997 as Columbus Neighborhood Health Center, Inc. That was our first name when the city of Columbus brought together the 7 independently operated community-based health centers and created one system of care known as Columbus Neighborhood Health Center, Inc. We changed our name in 2015 to PrimaryOne Health to really let the community know that we were one system of care with one voice, with one healthcare mantra that we are one. And so we're very proud of that 25-year history as one system. We've grown substantially since then from 7. Now we have 12 health center sites and 2 mobile health centers so that we can drive good health out into the community.
Well, congratulations to you and your staff for that. 25 years is a milestone. As we begin to, dive into 2022, we're still dealing with this pandemic. How has the COVID-19 variant affected underserved communities?
Well, unfortunately, Sean, as what we've learned with the original COVID virus, is that it still is disproportionately impacting communities of color, racial and ethnic populations who in many cases have financial, social, and cultural barriers to healthcare. And so the new variant, which is much more contagious, many times families are more closely congregated They live in communities that are close. And so the variant can pass even more quickly. Thankfully, if they have had the COVID vaccine, whether it's J&J, Moderna, or Pfizer, they won't end up in the hospital. And particularly if they've been given the third shot or the second shot in the case of J&J as a booster, because this new variant, Omicron, is much more contagious. And so we have heard of breakout cases of individuals who have had their vaccine, both vaccines and their booster, and they've still developed COVID symptoms, but they haven't ended up in the hospital on a ventilator, or we haven't heard of deaths. And so that's the message I would share with our listening audience, is that it is still critically important, particularly communities of color, that we get vaccinated, that we get that third shot or the booster, so that we can prevent ourselves from getting it and passing it to others. And what's important is if there are children in the household and they're 5 years of age and up, that they can have the COVID vaccine. And that's really important too, because we do have little ones that have been hospitalized because of COVID.
You know, that's what we continue to talk about is COVID. You know, before we conclude, let us know a little bit about some of your other healthcare service lines that you guys provide in 2022.
Well, as we talked about COVID, Sean Anthony, it's really important for people to understand that it has had an impact on our health and well-being in other ways. Many people are developing depression because they've been isolated. And so we have behavioral health services. We have an excellent behavioral health services team. We also provide dental care and vision care. If you need a new set of glasses, if you need your eyes tested because you've seen some weakness in your vision, you can come to PrimaryOne Health. Of course, we have women's health, we have pediatrics, so we can see children, we can see adults. We have physical therapy services. So we have comprehensive primary care services, including the vision, the dental, the behavioral health, pharmacy, as well as nutrition services, and overall healthcare, integrated healthcare for our community residents.
I think that's good to for people to know that. How can people get in contact with PrimaryOne to get these resources?
Well, first of all, they can visit our website. They can go to PrimaryOne, PrimaryOne Health, HEALTH.org. Or if they're interested in getting a COVID test or a COVID vaccine, they can simply text the word vaccine, VACCINE, to the phone number 614-502-5329.
Ms. Tavares, it's always a pleasure. The CEO of PrimaryOne, Ms. Charleta Tavares, thank you so much for sharing this valuable information with our listeners.
And thank you very much, Sean Anthony, for providing this opportunity with Eye on the Community.
Yes, ma'am. Thank you. Have a good one.
You too. Bye-bye.
Bye.